Hi there, my name's Summi Abdul. I'm one of the gynae cancer and keyhole surgery consultants from Royal Derby Hospital. I've been here as a consultant since 2007, and I do lots of keyhole laparoscopic surgery and cancer surgery. Well, I suppose growing up, my mum was in and out of the hospital a few times with various ailments, so I saw doctors as people who actually helped people, cured people, and made them better. And I felt that I could probably do that, and because it provided a stable job and effectively you were helping people, then I thought that's something I wanted to do. So that's what I decided to become a doctor. I didn't know what sort of doctor to become, but I just wanted to become a doctor when I was first, the very first memories I have. Yeah. Well, as a medical student, I was very quiet and shy and reserved, and I would have said boo to goose. So if somebody would have said to me, "Do you want to become a surgeon?" Then I would have actually said, "Absolutely not on a bottom dollar." But then I was fortunate enough to work for a lovely consultant in Leeds called Tom Brennan, who let us go to theatre and do surgical procedures. And then I suddenly thought I quite enjoy this. This is good. This is something I'm good at. And I enjoy the fact you could solve and cure problems and make people better fairly rapidly. And then I thought, what do I want to do? I didn't want to become a general surgeon because I didn't think I was that sort of character. I thought obs and gynae had a good mixture of medicine and surgery. And then, so I decided to do obs and gynae, and then gynae oncology and keyhole surgery is really with a passion that I went down. So I did general obs and gynae training, then did subspec training in various places. So I trained in Leeds initially, then went down to the Oxford rotation, working in Northampton, Kettering, Oxford, and then became a cancer specialist in Sheffield, and then did a sort of keyhole surgery fellowship in Toulouse. So gynae cancer has got most extremes of surgery, and then the keyhole surgery aspects is something that is amazing. You can do operations and procedures by 3 tiny little cuts, and the recovery is phenomenally different, and it recovers so quickly. I think the most rewarding bit of my job is the fact that we help people and help patients and give them cures for either cancers or even for benign conditions such as heavy periods or painful periods. The big thing is doing things like keyhole surgery, and that's what we've transformed the job, the service from what used to be the case that everything was done by open surgery, but now laparoscopic surgery has sort of transformed things. So we do keyhole hysterectomies, and the patients will come in one day, go home the next day. They have 3 tiny cuts, often say they have a little or no pain. So that's a highly rewarding bit of the job, seeing patients recover, often elderly patients or even younger patients, and it's life-changing in terms of what their quality of life or in terms of cure for their cancer. And the other aspect of my job is that I do a lot of teaching and training. We teach consultants and doctors across the country on how to do keyhole surgery and operations, and we run courses for that, and we run lots of conferences and training, which we have people from nationally and internationally registering online with the Delta Centre, and so it's very varied in terms of what my job is, but the surgery and seeing patients getting better is the most rewarding bit of it. I think I try and talk to people the same way I'd want to be spoken to, or what way I'd want my mother or my wife or my daughter to be spoken to. I try to talk to people on a human level, rather than there being a barrier. We'll go through the problems and the reasons they come to see me, and try and come up with the most rapid and appropriate solutions. They're given options. We have a frank discussions of the pros and cons of all the different treatments available, the likely diagnosis, and the likely path forward. And then we try and get those things organised and arranged for the patient as promptly as possible, keeping in mind their fertility requirements, their age, what they want in terms of their solutions. Obviously, with cancers and things, it's fairly straightforward. With other things, often patients get, like endometriosis or heavy painful periods, they often get disregarded for many, many years without a solution. So hopefully, what patients get out from me is solutions and a resolution to their problems.